Welcome to Module 3.5, where we'll explore quasi-experimental research designs in healthcare. These designs occupy an important middle ground in research methodology, offering practical approaches when true experiments aren't feasible. In this module, we'll define quasi-experiments, examine various pre-post designs, and take a closer look at interrupted time series designs that are particularly valuable in healthcare policy research. Quasi-experimental designs are characterized by the absence of random assignment to treatment conditions, though researchers still manipulate the independent variable. These designs are employed when randomization isn't feasible due to ethical, practical, or resource constraints. Quasi-experiments represent a trade-off between the rigorous control of true experiments and the authenticity of real-world conditions. While they provide stronger evidence than non-experimental designs, they offer less certainty about causality than randomized experiments. The key challenge in quasi-experimental research is addressing threats to internal validity through careful design and statistical controls to strengthen causal inferences, despite the lack of randomization. Various pre-post designs form the backbone of quasi-experimental research. The simplest is the one-group pretest, post-test design, measuring outcomes before and after intervention without a control group. Non-equivalent control group designs add comparison groups that weren't randomly assigned. Time series designs involve multiple measurements over time to establish trends before and after intervention. Multiple baseline designs stagger intervention implementation across different groups or settings, providing internal replication. Regression discontinuity designs assign participants to conditions based on a cutoff score, approximating randomization for those near the threshold. Each design addresses different research needs and constraints, with varying levels of control over threats to validity. Interrupted time series is a particularly robust quasi-experimental approach, featuring multiple observations before and after an intervention. This design effectively controls for pre-existing trends by establishing a baseline trajectory that can be compared to post-intervention patterns. It allows detection of both immediate impacts and delayed or evolving effects over time. Analysis typically employs segmented regression to identify changes in level and slope of the outcome measure following intervention. This approach is especially valuable for evaluating healthcare policies, quality improvement initiatives, or system-wide interventions where randomization is impractical. When available data support sufficient pre- and post-intervention time points, interrupted time series provide some of the strongest evidence outside of randomized trials.